Almost half of the hospitals in Tennessee are at risk of closing. The State Hospital Association says that is twice the number at risk from before the pandemic. Liam Collins is in the studio to share how the statistics are affecting rural hospitals around here. Liam.
Yes, indeed. Tennessee ranks in the top 10 states specifically for rural hospitals that are at immediate risk of closing. It's a statistic that could become a serious problem for our rural hospitals very soon as expenses rise and staff start to walk out the door. More and more Tennessee hospitals are closer to flatlining. The industry has struggled to rebound from the strain put on them by the COVID-19 pandemic.
There's a lot of economic and supply and labor challenges.
Curtis Vann is the vice president of federal relations for the Tennessee Hospital Association. Earlier this year, the statewide organization said 45% of hospitals across the state are at risk of closing. Part of that issue is federal reimbursements for Medicare services. The THA says most rural hospitals in the state are not reimbursed at a rate that keeps up with their expenses.
It's just a downward spiral in terms of the money that you receive, and then you are unable to kind of pay your employees at the rate they need to kind of retain them.
The association says nearly 60% of hospitals operated at a net financial loss in 2022, an average profit loss of nearly 3%, worth about $500 million. It's hit rural hospitals the hardest. The National Center for Healthcare Quality estimates nearly half of all rural hospitals in the state are at risk of closing.
You're just not getting the reimbursement that you typically would.
On top of that, operation costs are much higher too. Hospitals across the state have seen more than $3 billion in cost increases since 2019. A bill sponsored by Tennessee Senator Marsha Blackburn and Georgia Senator Raphael Warnock would increase rural hospitals' federal reimbursement rates. Vann says it's a very good start.
There's just so many hospitals that are below the floor that bill establishes, and so that would just provide some certainty.
Operating margins overall are down to more than 2/3 since the pandemic. You can read the entire report from the Tennessee Hospital Association on our website, local3news.com. Cindy?